Nepal is an exotic and fascinating country. It's also enormously complex and still struggling with the aftermath of a 10-year insurgency which officially ended in 2006. Today, ideological differences are overshadowed by other daily struggles, such as extensive power cuts, inadequate water supplies, frequent fuel shortages, traffic congestion, and routinely serious air pollution. The environment in Kathmandu is decidedly under threat, and perhaps its biggest menace is municipal solid waste. All too frequently, city residents resort to burning solid waste in the streets, augmenting other sources of air pollution in the Kathmandu Valley and contributing considerably to local air pollution levels. This is a meeting discussing how to dispose of nearly 10 tons of expired pharmaceutical and family planning products. The United States Agency for International Development wants to set a precedent for disposing of pharmaceutical waste in a responsible and environmentally friendly manner.
Contraceptives, such as oral contraceptive pills, contain chemicals and hormones, and the packaging for these materials also include plastic and other materials that are not biodegradable. So if not disposed of properly, these waste products can have very negative consequences on the environment and the surrounding communities. So to ensure that we are protecting the environment, we need to always use well-defined and well-established processes that minimize the impact on the environment.
USAID and FHI 360 identified local healthcare waste experts Healthcare Foundation Nepal, HECAF, to develop and implement a workable disposal plan. Here's how they did it. These boxes contain family planning materials with expired use-by dates. Here there are more than 2 million male condoms, more than 4,000 oral contraceptive pills, over 5,000 injectable kits, and all associated paper, plastic, and aluminum foil packaging. HECAF's plan is to break down the expired commodities into recyclable groups: paper, plastic, rubber, glass, and to separate out active chemical components for special treatment before disposal. Where recycling isn't possible, the materials will be disposed of in a way that protects the environment and safeguards against any misuse. Implementation of the plan started by putting order into the chaos. HECAF weighed and coded all the large cardboard cartons and logged the batch lot numbers and expiry dates of all the products. This data would later be useful in tracking just exactly how much product was recycled. Once logging was completed, large cartons were dismantled and dispenser boxes and packets were prepared for processing. In the case of condoms, the dispenser boxes were stacked in the cutting area where a modified industrial paper cutter was deployed to cut the condoms to prevent any misuse. Power cuts of up to 14 hours a day during the implementation phase made working the cutting machine difficult. In order to meet the projected deadline, teams had to work whenever electricity was available, even if this meant working through the night. Once the condom packets were cut, a labor-intensive process separated out the rubber, cardboard packaging, plastic packaging, and thin paper. The key to this process is separating the recyclable bits and keeping them separate by category. If the waste is mixed, recyclers cannot use it and will not buy it. In this case, only the plastic packaging encasing the condoms could not be recycled. Contraceptive pills were separated in 2 steps. First, the packaging was dismantled into light cardboard, paper, and plastic and foil pill packet. In the second step, the foil packet pills were removed from the packaging. The ethinyl estradiol and the nogestrol tablets were kept separate from the ferrous fumarate because they are categorized as risk waste under World Health Organization classification. these chemicals must be neutralized and made safe before disposal. This process will be illustrated later in the video. Ferrous fumarate poses no threat to humans or to the environment and can be handled as ordinary waste. Only the aluminum-backed plastic pill packets could not be recycled. Processing the Sanghini injectables was also divided into multiple steps. The first step was to separate the contents into constituent parts: the vial with medication, the syringe pack, and the light cardboard box. The syringe is then removed from its packaging, and its light paper and plastic wrappings are also separated out. The same process was repeated for a slightly different syringe pack. In the second step, the vials were pried open and the medroxyprogesterone poured into a temporary container, which was subsequently processed as risk waste and encapsulated in a process to be illustrated later. The vials were later washed and sent to a glass recycler. The rubber vial plug and the aluminum retainer rings were separated and recycled. More than 5,000 syringes were collected from the Sanghini kits. Since these needles and syringes were unused, there was never any risk of infection contamination to workers during processing. However, in order to prevent any possible misuse, the needles and syringes were destroyed. First the needle was cut, and then the syringe rendered useless. Both the metal from cut needles and the plastic syringes were recycled. Needle cut, syringe destroyed. Prior to dispatching the cut syringes for recycling, an additional cautionary step was taken to prevent any syringes from being repackaged on the black market and resold to pharmacies. This shredder, originally designed to process grains, was locally modified for this task. In this video, we have encountered on several occasions waste categorized as risk waste. This is defined by WHO as infectious and/or hazardous waste that poses risk to both human health and to the environment, and therefore requires special treatment before disposal. To make risk waste safe for disposal in landfill sites, one WHO recommended option is encapsulation. There are quite a few variations on this technique. WHO publishes several reports and guideline booklets on the subject.
Encapsulation for HECAF is accomplished with a 20-liter drum made from recycled plastic. The wire mesh is cut to create both a base and an internal meshed cylinder. Concrete is prepared as an immobilizing agent for the pharmaceuticals.
The concrete is then laid as a base and the meshed cylinder inserted. A cylindrical mold is inserted inside the mesh, and the outside area is filled with concrete and left to partially solidify. Meanwhile, the pharmaceuticals are prepared. As ever, weight is recorded to track recycling results. The pharmaceuticals are crushed, and in the case of nogesterone and ethinyl estradiol, methanol is added because these two compounds are not soluble in water. After approximately 2 hours, the cylinder mold is removed and the paste mixture is poured into the void.
अलि अगाडि अलि अगाडि
Once the container is sealed and labeled, it can be safely transported and buried in a commercial landfill site. Of the nearly 10 tons of waste processed in this exercise, only 14% was sent to landfill, and that mostly the non-recyclable plastic condom packets and the specially treated and prepared pharmaceuticals. More than 99% of the total waste was non-risk. By far the largest category of waste recycled was cardboard, both heavy grade and light. Nearly 4,000 kilos were recycled into new paper-based products for industrial and consumer markets. The second highest volume by category to be recycled was rubber from condoms. Again, nearly 4,000 kilograms. The condoms are now tires. In fact, this entire list of items separated and recovered in waste processing were successfully recycled. The revenue generated from recycling was nearly $300. While this income is clearly not sufficient to cover the cost of the project, it has to be measured against overall environmental and community impact. While there are complex formulae to assess environmental impact, like the U.S. Environmental Protection Agency's waste reduction model, these technical approaches tend to produce scientific and data-centric conclusions. In human terms, it remains very difficult to measure the overall positive impact on people's lives of not burning the waste and thereby not contributing to air pollution. Once again, in human terms, how do you accurately measure the overall impact of not burying waste and thereby eliminating the risk of contamination to groundwater? In human and in public health terms, how do you measure the consequences of keeping expired medications out of reach of rag pickers and black marketeers? USAID has made its priorities clear.
Unfortunately, all organizations and companies dealing in pharmaceuticals are at some point forced to dispose of expired or damaged products. And so while we try and minimize this to the greatest extent possible, it still happens. And when it does, it's extremely important that those commodities are destroyed in a manner that is safe, proper, and without environmental consequences that can impact local communities.